Hi everyone, my name is Dr. Igor and I am a clinical oncologist practicing since 2010. Today we are continuing our playlist of videos about adjunctive, complementary, some helpful additional methods of treating cancer. So today our topic is ozone therapy. Let's get started. Okay, what is ozone? Ozone is the molecule O3 which is produced, for example, during the heavy rain, during the storm, and you can feel this very nice scent during the storm. So this is quite an aggressive molecule which is behaving itself as the free radical. And can it be used against cancer as an adjunctive therapy? First of all, there are articles of 1958 where the scientists were studying ozone says that it behaves itself like radiation because it is a free radical that attacks the cells. It can damage the DNA, and if it's used with X-ray, for example, it will have a synergistic effect. So why does it happen? It has a direct attacking effect on cancer cells, and this was proven in many studies in laboratory on cancer cell lines. Why? Because it's free radical, because when the free radicals come, the cells try to protect themselves with antioxidants, and when the antioxidants deplete, then the free radicals just damage and kill the cell. And when the oncologists use, for example, chemotherapy or radiation therapy, this also produces free radicals that will kill cancer cells. So if we add ozone, it will enhance the effect of chemotherapy and radiation therapy. That was, by the way, proved by many preclinical studies and also by animal studies. But in clinical practice, we can't expect that ozone will come too deeply into the body, find the tumor, accumulate there. It's very unstable molecule, but it has some indirect mechanisms. The most important mechanism is activation of immune system. And this was also proved in many studies, especially animal studies. For example, I will say in general, there are many studies. For example, there were rabbits with tumor somewhere on their ear, and there were rabbits with lung metastases, and they took two groups of rabbits. One got the ozone therapy, the others did not. And by the way, ozone was injected into the peritoneal cavity, into the belly, and the tumor is not in the belly, but the tumor that was located far from the belly shrinked, or even metastasis gone away, and this underlines that there is some other distant mechanism. So when the rabbits who got this great effect were given their drugs to deplete their immunity, to suppress the immunity, there was no effect of ozone at all. And when the rabbits who got great effect of ozone when their lymphocytes, when their immune cells were taken and injected into the other rabbits who didn't get any effect, those rabbits got the tumor regression too, meaning that the main effect of ozone may be the immune system activation. By the way, some studies showed that ozone can turn cold tumors that are not seen by the immune system into hot tumors, really infiltrated by immunity. And that is very good. And there are also some animal studies that show that ozone added into radiation therapy, for example, may enhance its effectivity. The other mechanism is influence on the blood flow and hypoxia in tumor. Tumors may have low blood flow and oxygen, and this will stimulate them to produce more blood vessels, and this hypoxia will protect their tumor stem cells from dying and from being attacked by any drugs. Thus, the tumor will survive better, it will grow better, it will metastasize better. And there are some methods that are aimed at increasing the oxygen and blood flow in tumors, especially during chemotherapy. This will improve the chemotherapy drugs coming into the tumor and attacking it, so it will decrease its survival and metastasis. And ozone is one of such therapies that may decrease the hypoxia in the tumor. But will it work on real patients? Unfortunately, nowadays there are no good double-blind, randomized, placebo-controlled studies on real oncology patients. But there are some not very well performed studies, but some of them are showing quite promising results. For example, they took two groups of patients with cancer, and some patients got just standard chemotherapy, the other patients got just ozone because they couldn't survive chemotherapy because their state was very bad, their cancer was very advanced. That's why this comparison is not very good. But both groups, they survived the same time. That's why the ozone was comparable with chemotherapy, but less toxic, well tolerated. The other study showed better response to radiation therapy in prostate cancer patients, for example, improved quality of life in some patients, improved survival. One study showed better restoration of liver function, for example, in patients with cancer-related jaundice, when their hepatic dysfunction occurred because the tumor blocked the bile outflow. And also there was one interesting case of anaplastic astrocytoma, which is an aggressive brain tumor, and the patient got ozone therapy, and he is alive for 11 years already, and feeling himself very well, but it's just case report. We don't know why it happened, why it was such a great effect, but it gives us hope. So, dear friends, this is all for today. Unfortunately, not enough clinical studies, but hopefully in future we'll have some more information about it. Especially it would be very interesting to compare the effectiveness of just chemotherapy with chemo plus ozone therapy or ozone plus immune therapy, for example, to make the tumor from hot, turning it from cold to hot, and then using very effective immune therapy to kill this hot tumor. So there are many different options for investigations. The problem is these investigations are very expensive, and it's quite difficult to find funding to perform them. But this is hint for those who have this kind of sickness, and I hope it will really be useful for those people. I wish you good luck, God bless you, have a good health, and bye bye.